Hello everyone, my name is Mira and in this presentation I will be discussing the effective use of digital innovations like Geographic Information System or GIS map that has the potential to improve data-driven decision making, planning and program implementation. I'm also going to talk about the impact of GIS maps on improving routine childhood vaccinations for hard-to-reach population in the United States. This includes careful planning and execution across several key areas. So let's start. In the US, the routine childhood vaccination rates vary, leading to lower immunization coverage and increased risk for vaccine preventable diseases. Certain hard to reach populations face systematic barriers, for example, people living in rural areas, low income families, specific racial and ethnic minorities, and those with limited access to healthcare. The solution is exploring how Geographic Information System or GIS maps can be used as a powerful tool for identifying and addressing these coverage gaps. Childhood immunizations in the United States. Vaccinating children according to the recommended schedule is one of the best ways to protect children from harmful and potential diseases like measles, mumps, rubella, polio, and many more. As you can see in this chart, the recommended immunizations for children from birth through 6 years. So, what is the challenge here? There is a critical drop. The vaccine coverage for many routine childhood vaccinations has started to decline in the recent years, especially among children. So, these inequities in childhood vaccination rates has documented by CDC based on factors like race, ethnicity, and poverty status. This decline creates concerns for public health experts who worry about outbreaks and also loss protection for most vulnerable. Now, to combat this challenge, Geographic Information System has emerged as a valuable tool in addressing these disparities. So, what is GIS? If you do not know, GIS is a framework for gathering, managing, and analyzing data using spatial location. It also presents complex data as interactive maps, making patterns and relationships to visualize and understand. This actually helped the health agencies to identify areas of low vaccine coverage. So they can plan effective interactions. Sorry, so they can plan effective interventions and track progress over time. So let's see the historical context of GIS in the public health, how it has emerged and how we have come to now. So in the early years, it is used as a disease mapping. In 1854, Dr. John he used to track cholera outbreak in London. Now, with the advent of computer technology, GIS has evolved to integrate vast amounts of data for advanced spatial analysis. Now it is also used for disease surveillance, outbreak management, and health service planning in the expanded application. Identifying the missed population. So let's see what is actually going on. So as you can see in this chart, there are a number of states with exemption rates in select groups by school year. Now this trends the exemption rates for not having the vaccinations. So this trend began during the COVID-19 pandemic and has continued through 2024 school year, leading to approximately 138,000 kindergartners being exempt from one or more vaccine. Now, with the help of GIS, we can identify these vulnerable populations located statewide. In this map, you can see the percentage of children receiving vaccine. For example, the percentage of kindergartners who receive measles, mumps, rubella vaccine during the 2024 school year shows that 80% in Idaho and between 80 to 85% in Wisconsin and Alaska, and the rest 85 to 90% in Utah, Arizona, Colorado, Oklahoma, and Minnesota, and so on. In the second map, you can see the percentage of children claiming exemption. Here, Idaho stands first with more than 12%, and then followed by Utah between 9 to 12%, and then Oregon, Nevada, Arizona, and so on. As you can see, all those light colored orange. Now, based on this information available, the GIS has planned the best routes to combat which neighborhoods are at highest risk, supporting a swift action. This one also allows to place temporary clinics in community centers, schools, or places of worship where coverage rates shows greatest needs. Now let's understand the barrier. Some studies shows that lower vaccination coverage can occur in areas where there are not a near vaccination facility. So there are also several other factors that contribute to reduced vaccination rates among hard-to-reach groups. So one is the physical distance from healthcare provider. It limits access to regular well child visits where most vaccines are given, and limited transportation options often also makes attending appointments difficult, especially in rural settings. And insurance status also plays a major role with uninsured children like less likely to complete the vaccine series. There are some other communication barriers like cultural misunderstandings or historical mistrust also cause families to avoid or refuse vaccines offered by the clinics. Now, to address these problems, health departments need targeted strategies to go beyond general public messaging. Identifying where coverage is lowest and understanding who remains at risk are critical steps for improving immunization rates nationwide. So let's see how we can optimize outreach and resource allocation. Based on the information available, GIS map can help plan the best routes to combat which neighborhoods are at highest risk, supporting a swift action. This one also allows departments to place temporary clinics in community centers, schools, or places of worship where coverage rates shows target greatest needs. And then planning a mobile clinic for communities with poor access um, can identify optimal location for mobile vaccination units, and this will be a most efficient routes for mobile teams. Now, GIS analysis, with the help of GIS analysis, these public health officials can also target interventions to communities and populations in need, ensuring that limited resources are used effectively. They can actually track vaccine inventory and supply levels, and they also help in preventing shortage in critical areas where the vaccine is most needed. Besides that, we can also empower communities with accessible information. So GIS allows health departments to create targeted hyper hyper local communication campaigns with community organizations and local leaders in specific areas to deliver culturally relevant and trusted vaccine information. Also, a vaccine locator tool can help families find nearest clinic or pharmacies and the hours of operation, and also they can make appointment availability so they can reach out to the resources. Data and technology integration. By now we know how GIS works. It turns complex data into interactive maps and dashboards and revealing patterns and relationships that are otherwise hidden. So an example of GIS dashboard can also display metrics like vaccination rates over time, appointment completion rates, and coverage goals. Here, the CDC VaxView system is a very powerful resource that provides geospatial data to inform, plan, and evaluate vaccine activities. And other data sources are Immunization Information System, IIS, or census data, or socioeconomic indicators can also be used. The real-time tracking, these dashboards can provide real-time updates on vaccine inventory and administration. It also enhances the situational awareness. Monitoring progress with GIS dashboards. Here, public-facing dashboards can keep stakeholders and the public informed about the progress of vaccination efforts, helping to build trust. They can track progress towards immunization goals and monitor how equally vaccine resources are being distributed. The decision makers can get a live view of vaccination efforts, allowing them to respond quickly to changes and the resource needs. Let's see some of the case studies that have actually applied GIS and how it has evolved. So they used for COVID-19 and flu distribution. So during the COVID-19 pandemic, the Texas Children's Hospital used GIS dashboards to visualize vaccination rates. They prioritize vulnerable population and track distribution. This approach has helped local health departments match vaccination sites with priority populations, and they also helps in filling the coverage gaps. Similar strategies were successfully applied for seasonal flu vaccines, demonstrating the replicability of the GIS approach resulted in significantly higher vaccination rates compared to previous years. GIS guided interventions also make the best use of limited resource target vaccines where they will have the largest effect and savings public funds in the process. Now let's see raising vaccination rates in unserved communities, how it can benefit the whole as a society. Higher rates of immunization establishes herd immunity, which is protecting those who cannot receive vaccines, such as infants or those who with certain medical conditions or pregnant women. Outbreak prevention keeps schools open and it saves families from lost verdict and prevents expensive hospitalizations. It can also build community trust when outreach reflects the diverse needs of local residents. When people see public health agencies paying attention to specific neighborhoods and addressing unique barriers, they are more likely to participate in immunization programs. So, in general, as you can see, the GIS mapping encourages collaboration among schools, local governments, and nonprofit organizations and clinics, improving the chance that every child will receive needed vaccine. Now, with that advantages, there are some challenges and considerations needs to be careful about. Despite we all know that there are clear benefits using the GIS technology, um, there are some privacy concerns that must be managed carefully to avoid sharing sensitive health information about small groups or individual families. Agencies must rely on accurate and current data. Outdated or incomplete records can lead to missed opportunities or wasted resources. And then also investment in staff training ensures that GIS maps are interpreted correctly and that results support effective and ethical planning. No, at the end, I just want to conclude that GIS moves beyond one size fits all approach by providing the strategic precision needed to address the diverse factors which are influencing the immunization rates. GIS has enabled public health officials to make evidence based decisions so they can prioritize resources and then strengthen the overall health system. As technology advances, GIS will remain the central to equity focused approach that keep all communities healthy and safe. With the help of GIS mapping or advanced technology alone cannot erase vaccine hesitancy or solve every barrier, but it requires ongoing partnership with trusted community leaders, continued education and adaptation to changing community needs. So when these are paired with approaches, GIS stands out as a vital component in modern public health planning. If you have any questions, you can reach out. Thank you.